Lamotrigine, a medication that has become a cornerstone in the treatment of various neurological and psychological conditions, represents a significant advancement in medical science. Its journey from discovery to widespread clinical use is a testament to the rigorous research and development efforts aimed at improving patient care. As a healthcare professional, my first-hand experiences with Lamotrigine have reinforced its value in therapeutic practices. This video seeks to explore Lamotrigine in depth, shedding light on its uses, benefits, and the spectrum of its effects on patients. The inception of Lamotrigine in the pharmaceutical landscape marked a pivotal moment. It was initially developed to treat epilepsy, but soon its utility was recognized across a broader spectrum of disorders. This broad applicability underscores the versatility of Lamotrigine as a pharmacological agent. The journey of a patient beginning treatment with Lamotrigine is often filled with hope, as this medication offers the promise of control over debilitating conditions that might have otherwise compromised their quality of life. Understanding the scope of Lamotrigine's impact involves a comprehensive look at its applications, benefits, and potential drawbacks. This exploration will provide invaluable insights for both healthcare professionals and patients alike. It is crucial to approach this discussion with a balanced view, acknowledging the significant positive outcomes it can facilitate, while also considering the risks associated with its use. Medical conditions treated with Lamotrigine. Lamotrigine has been heralded for its efficacy in managing a diverse range of medical conditions, a fact that has solidified its standing in treatment protocols. Primarily, it is utilized in the control and management of epilepsy, a neurological disorder characterized by recurrent seizures. The effectiveness of Lamotrigine in reducing the frequency of these seizures has been a beacon of hope for many patients. It is not merely a symptomatic treatment but a means to regain a semblance of normalcy in their lives. Beyond epilepsy, Lamotrigine has found its place in the treatment of bipolar disorder. This psychiatric condition, marked by extreme mood swings from manic highs to depressive lows, can be profoundly disruptive to daily functioning and overall well-being. Lamotrigine acts as a mood stabilizer, helping patients achieve a more balanced emotional state. The significance of this cannot be overstated, as it empowers individuals with bipolar disorder to lead more stable and fulfilling lives. The application of Lamotrigine extends to other areas as well, including its off-label use in certain cases of neuropathic pain and depression. This versatility underscores the medication's potential to influence various pathways within the body, offering relief in conditions beyond its original indications. Each patient's story of recovery and improvement is a testament to the broad therapeutic potential of Lamotrigine. Benefits of using Lamotrigine. The benefits of Lamotrigine are manifold, providing patients with a chance to experience significant improvements in their health and quality of life. One of the primary advantages is its ability to offer control over seizures for individuals with epilepsy. This control is not just about reducing the frequency of seizures but also about minimizing their intensity, which can have a profound impact on a patient's autonomy and safety. For those grappling with bipolar disorder, Lamotrigine serves as a cornerstone of mood stabilization. It allows for periods of stability where patients can engage in their personal and professional lives without the constant threat of mood swings. This stabilization is crucial for long-term management of the condition and helps in preventing the extreme episodes that characterize this disorder. Moreover, the tolerability profile of Lamotrigine is notably favorable compared to other medications in its class. It often presents with fewer side effects, which is a significant consideration for long-term treatment. The importance of this cannot be overstated, as managing side effects is a critical aspect of adherence to medication. Patients are more likely to continue with a treatment plan that does not compromise their daily functioning with intolerable side effects. Potential side effects of Lamotrigine. While the benefits of Lamotrigine are significant, it is imperative to acknowledge its potential side effects. These can range from mild to severe, impacting patients in various ways. Common side effects include dizziness, headache, blurred vision, and nausea. These are typically transient and often diminish as the body adjusts to the medication. However, They can be unsettling and may require additional support from healthcare providers to manage. A more serious concern associated with lamotrigine is the risk of developing a rash, which can be a sign of a potentially life-threatening reaction such as Stevens-Johnson syndrome or toxic epidermal necrolysis. This risk, although low, necessitates vigilant monitoring for early signs and immediate medical intervention if symptoms arise. The gravity of these potential reactions underscores the need for careful consideration and discussion between the patient and their healthcare provider before initiating treatment. Additionally, there may be instances of cognitive side effects, such as confusion or memory impairment. These are less common but can be particularly challenging for patients, affecting their daily activities and overall quality of life. It is crucial for patients and caregivers to be aware of these possibilities, enabling prompt communication with healthcare professionals to address and mitigate these effects. Recommended dosage of lamotrigine. Determining the appropriate dosage of lamotrigine is a critical aspect of treatment, requiring a tailored approach based on individual patient factors. The process often begins with a low dose, gradually increasing to a therapeutic level. This titration is essential in minimizing the risk of side effects, including the serious skin reactions mentioned earlier. The specific dosage and titration schedule will depend on several factors, including the patient's age, the condition being treated, and the use of any other medications that might interact with lamotrigine. For epilepsy, the dosage may vary depending on whether lamotrigine is being used alone or in combination with other anti-epileptic drugs. Similarly, in the management of bipolar disorder, the dose must be carefully adjusted to achieve the desired mood stabilization without tipping into oversuppression of mood swings. Regular monitoring and consultation with a healthcare provider are imperative to ensure the dosage remains optimal. Adjustments may be necessary over time, as the individual's response to the medication or their condition changes. It is also crucial for patients to adhere to the prescribed dosage and not make any changes without consulting their healthcare provider. Mismanagement of the dosage can lead to suboptimal results or exacerbate side effects, undermining the treatment's effectiveness. Risks and precautions of using lamotrigine. Navigating the use of lamotrigine involves a careful consideration of risks and precautions to safeguard patient health. One of the paramount concerns is the potential for severe allergic reactions, as previously mentioned. Patients and caregivers must be educated on the early signs of such reactions and understand the importance of seeking immediate medical attention. This vigilance is crucial in preventing serious outcomes. Moreover, the interaction of lamotrigine with other medications presents another layer of complexity. Certain drugs can affect the metabolism of lamotrigine, either increasing its levels to potentially toxic concentrations or decreasing them to inefficacious levels. This necessitates a thorough review of the patient's medication regimen before initiating lamotrigine and ongoing monitoring thereafter. Pregnancy and breastfeeding pose additional considerations. Lamotrigine's effects on an unborn child or a nursing infant are areas of concern, requiring a nuanced discussion between the patient and their healthcare provider. The decision to use lamotrigine during pregnancy or while breastfeeding must weigh the potential benefits against the possible risks, always erring on the side of caution to protect the health of both mother and child. How lamotrigine works in the body. The mechanism of action of lamotrigine in the body is a fascinating aspect of its therapeutic profile. It primarily functions by stabilizing neuronal membranes and modulating neurotransmitter release. This action is achieved through the inhibition of voltage-sensitive sodium channels, which in turn reduces the release of excitatory neurotransmitters such as glutamate and aspartate. These neurotransmitters are known to play a key role in the propagation of seizures and in the modulation of mood. This modulation provides a dual benefit in the treatment of epilepsy and bipolar disorder. By dampening the excessive neuronal activity that can lead to seizures and by regulating neurotransmitter levels that affect mood, lamotrigine helps restore balance within the brain's chemical environment. This balance is crucial for maintaining neurological and psychological health. The intricacies of lamotrigine's action underscore the importance of precise dosing and careful monitoring. The goal is to achieve the therapeutic benefits while minimizing the risk of adverse effects, a delicate balance that requires an in-depth understanding of the medication's pharmacodynamics. This understanding enables healthcare providers to tailor treatment plans that maximize efficacy and ensure patient safety. Lamotrigine versus other anti-epileptic drugs. Comparing lamotrigine to other anti-epileptic drugs, AIDS, offers valuable insights into its unique position within the treatment landscape. Each aid has its own profile of efficacy, side effects, and mechanisms of action, making the choice of medication highly individualized. Lamotrigine stands out for its broad spectrum of action, efficacy in both focal and generalized seizures, and its utility in bipolar disorder. This versatility is a significant advantage, allowing it to serve a wider patient population. The side effect profile of lamotrigine is also a distinguishing factor. Compared to other aids, lamotrigine is often associated with fewer cognitive side effects, a lower risk of weight gain, and a generally more favorable impact on quality of life. These attributes make it an appealing option for long-term management, where the cumulative impact of side effects can be a major concern. However, it is crucial to consider that the effectiveness and tolerability of aids, including lamotrigine, can vary significantly from one individual to another. Genetic differences, the specific nature of the condition being treated, and the presence of comorbidities all play a role in determining the most suitable medication. Thus, while lamotrigine has many advantages, it is one of several options, and the choice must be tailored to the individual patient's needs. Frequently asked questions about lamotrigine. Throughout my practice, several questions about lamotrigine have recurred, reflecting common concerns and curiosities among patients and caregivers. One frequent question is about the time it takes for lamotrigine to start working. The answer varies, but improvements in seizure control or mood stabilization can sometimes be observed within a few weeks of starting treatment, though full benefits may take longer to manifest. Another common question pertains to the possibility of discontinuing lamotrigine. It is crucial to understand that lamotrigine should not be stopped abruptly, as this can lead to a rebound of symptoms or, in the case of epilepsy, an increased risk of seizures. Any changes to the medication regimen should be made under the guidance of a healthcare provider, who can advise on a safe tapering schedule if discontinuation is deemed appropriate. Lastly, concerns about long-term use of lamotrigine are understandable. Long-term therapy with lamotrigine, like with any medication, requires ongoing assessment of benefits versus risks. However, many individuals use lamotrigine successfully for extended periods with continuous monitoring and regular check-ins with their healthcare provider to ensure the treatment remains effective and safe. Conclusion: lamotrigine represents a vital tool in the management of epilepsy and bipolar disorder, offering hope and improved quality of life for many patients. Its broad applicability, favorable side effect profile, and effectiveness in stabilizing mood and controlling seizures make it a key component of treatment strategies. However, the journey with lamotrigine is highly individualized, requiring careful consideration of dosing, vigilant monitoring for side effects, and open communication between patients and healthcare providers. Understanding the nuances of lamotrigine's applications, benefits, and potential risks is crucial for maximizing its therapeutic potential while safeguarding patient health. As research continues to evolve, so too will our strategies for leveraging this powerful medication in the ongoing quest to improve patient outcomes. The dialogue between patients, caregivers, and healthcare professionals is essential in navigating the complexities of treatment and ensuring that each patient's path with lamotrigine is as effective and safe as possible.